If you or your child is a pitcher dealing with shoulder pain, clicking, or instability, you've probably heard about labral tears or capsule injuries, but not all shoulder injuries are the same, and not all recoveries are treated the same either. Today, I'm breaking down what capsule labral injuries are, why they matter for throwers, and what the path back to the mound really looks like if you want to stay healthy long term. Welcome back to the Mound Ready podcast, the show where baseball players, parents, and coaches learn how to protect their arms, build real strength, and get back to dominating on the field. I'm your host, Dr. Dominic Rangel. Let's jump into today's episode and get you one step closer to being Mound Ready. What's going on, everybody? I'm Dominic Rangel. I'm a physical therapist in San Antonio, Texas. Let's talk about capsular labral injuries. In simple terms, the labrum is the soft tissue ring that deepens your shoulder socket. The capsule is the strong, stretchy tissue that keeps the shoulder super stable inside of the joint. When we talk about capsular labral injuries, we're talking about damage to the structures that keep your shoulder joint secure, especially during the violent forces of pitching. You might have heard of terms like Hagel lesions or gaggle lesions. So Hagel lesions are humeral avulsion of the glenohumeral ligament, while gaggle lesions are glenoid avulsions. You can have anterior or posterior instability, which means front or back. And usually the injuries are from things like subluxations, where the arm pops out and back in, or it can be a dislocation. There's, of course, those people who are born loosey-goosey too. The surgery for repair would be different for each type of patient. For patients who are born loose, we would see something like a capsular shift or a plication. All of those who are torn loose, we usually see something like a Bankart repair. So the bottom line, these injuries can happen from trauma, like a hard slide, or from years of high-level throwing without enough stability work. So why does it really matter for baseball players? Well, here's kind of the scary part that most people don't even realize. Even 52% of MLB pitchers show some sign of labral damage on imaging, even if they aren't even feeling pain yet. And if you don't take care of it the right way early, you lose motion, you lose your strength, and your career starts to get shorter. We now know that throwing harder, playing year round, and specializing early puts more load on the shoulder capsule than literally ever before. It's not enough to just rest in ice. You have to rebuild the stability. It has to be super intentional. It can't just be going through the motions. The big question that people want to ask is, can you avoid surgery? Well, in many cases, yeah, of course you can avoid surgery, but only if the instability isn't severe. Non-operative treatment, it's going to focus on things like building dynamic stability, improving strength around the whole shoulder. You're going to have to work on fixing your mechanics if that's something that's needed, right? And you're going to have to monitor the symptoms carefully during that return to throw phase. But, big but, if there's pain, instability, or significant strength loss, surgery is probably going to be needed, especially if there's a large tear or the shoulder just won't stay in place. It keeps subluxing and popping out. But what does the recovery look like if you do end up needing surgery? Well, it kind of depends what kind of surgery you have. But if you have a capsular shift, application, or mid-substance capsule repair, here's kind of what you need to know. Recovery is a little bit slower than the labral repair because we're waiting on tissue healing to tissue. Early motion matters, but you don't want to get too tight or you're going to lose your velocity and you're going to lose your range of motion. But you have to respect the healing. Strength building focuses heavily on rotator cuff endurance and dynamic stability before throwing starts. Then you're going to move on to things like plyometrics and movement loading because you got to start to restore that elasticity without constraining the shoulder. But you got to start progressing like two-handed plyos to one-handed plyos, and then you're going to move into a throwing program. And it needs to be carefully monitored for something like volume, command, and strength. You can't just use pain as a guide whether or not you feel ready. But please understand, being cleared to throw is not the finish line. It's the beginning to start a smart, structured comeback to throwing safely at full speed. So, capsule labral injuries, they're not a death sentence. They're not the end of your career, but rushing the process, that can be. The athletes who return stronger are the ones who rehab the right way, respect the phases, and rebuild full shoulder strength, stability, and endurance. So, if you're dealing with shoulder instability or you're worried about making the wrong moves after an injury, comment on this post. Let's build a plan that keeps you and your arm ready for the long haul.